Hello everyone, and I'm just waiting for someone, one or two people can join in. If you can hear my voice, please type in the chat box that yes, you can hear me so that I can start the video. Can you hear? Am I audible to everyone? Okay, great. So, hello everyone, and I am Dr. Shireen Seni, as you all know by now, and I hope so. And welcome back to our channel, What After Dentistry. Now, recently, as you all know, we have launched our certificate course in Health Informatics, and since we launched it, we have been receiving a lot of requests. We have been receiving a lot of questions related to the certificate course in Health Informatics, and hence I thought that why not to come live and answer these questions, because most of the questions that we have received are kind of common questions that anyone coming for this particular course would have in their mind. So I hope you guys stay till the end and watch the video till the end. So now, before I'll start answering the questions, it is important that you please subscribe to our channel, because we would be going live, now and then, to have a lot of interactive sessions, to give you a lot of information on health informatics and business analysis aspect. So I request you all to please subscribe to my channel. It's absolutely free, as you all know. Now, coming to your questions, without further ado, let me start off with the very first question. So the first question that we generally receive is, who can pursue the certificate course in healthcare IT? Now, anyone who is coming from a medical background or from a life sciences or paramedical background, they can pursue healthcare informatics as a career option. Somebody who's done MBBS, BDS, BAMS, BHMS, BUMS, people from life sciences and paramedics background like BPT, occupational therapist, B Pharma, anyone who knows healthcare, domain, they have worked in the healthcare domain, or they belong to this healthcare domain, they can pursue healthcare informatics. And so the second question that we receive is the course technical in nature? Do I have to learn any programming language? So the answer to the answer to this question is no, it is not technical at all. You don't have to pursue any kind of a programming language like C++ or Java or HTML. In fact, the only technicality that is involved in this particular course of health informatics is you need to grasp and understand the business analysis concepts and the tools that are required to do the business analysis related documentation like MS Visio, Balsamic, and even Power BI. So these are very, very easy tools. There is no technicality as such to learn a programming language, and these are very easy concepts to grasp. You just need to be very consistent with learning these concepts, and eventually you will definitely grasp them. Now, coming to the technical language or the programming language, if you really want to learn something, that will only come handy if you want to go into healthcare data analytics or business analytics. Now, business analytics is totally different from business analysis. So analysis is wherein you will be defining the product requirement, you will be defining the product blueprint. So let me give you an example. Now, whenever somebody wants to build a house, what do they do first? They will first draw a picture of the house, how the house is going to look like, or the building should look like, on a piece of paper. Or if it's a big project, then they will generally create those miniature, masterpieces, the architectural masterpieces that are created. So you first create a blueprint, you first create a drawing or an image of how the house will look like. Once you have that in place, then only people who are responsible to build a house, you will be calling builders. So they will be building or developing the house, or the project, if it's a big project. Similarly, in the information technology industry, whenever you build any software or whenever you build any kind of a product, whether it's a mobile application or whether it's a website, even for a simple website, or even if it's a web-based application, any software, you first create a blueprint on a piece of paper, and this blueprint is where what we call as a part of business analysis. Whereas business analytics is related to once you have, somebody is using your software, you have a lot of data. Now you want to get into that data, like what kind of patients the hospital is seeing on, frequent basis, or what kind of diseases are more prominent in a particular geographical area. So all these kind of data analytics, if you want to do, then you will have to understand programming language, and that also at a very basic level, which we call as R programming or Python. But coming from the industry, working in the industry for the past 7 to 8 years, it is always advisable that you first work on the functional side of products or software. You work, how you start your career with a basic understanding of healthcare informatics, start your career in health informatics, work for around 2 or 3 years, understand how the industry works, and then gauge your interest. If you're actually interested towards data analytics, then only go for these kind of courses, because these kind of courses are a little on a costly side, but then they obviously pay well also. So only pursue data analytics or business analytics if you really have interest towards doing analysis of the data. But initially you don't actually have to learn any kind of programming language. So to just compile whether you want to learn a programming language to start your career in health informatics, no, you don't need any kind of programming language exposure. The third question that we receive is, should I pursue certificate course in healthcare IT or a master's degree in healthcare IT? Now, before I even answer this, you need to understand that there are pros and cons of both the kind of degrees that you want to pursue. Whether you go for a certificate course or you go for a master's degree, both of them has their own pros and own cons. Talking about the differences between the two, so the certificate course, if I have to talk about the course duration, in certificate course, generally the course is around 3 to 6 months, and master's degree is as usual. You have, it's a 2 year full-time regular master's course or a degree course that you have to pursue. So that's on the course duration. Talking about the second point, which is the fee structure, of course, because it is a certificate course, the fee structure of certificate courses is more or less between, on an average, it's between 10 to 20,000 for the entire 3 months or a 6 months course. And going for a master's degree, this will generally cost you around 4 to 5 lakhs. It can also increase based on the institution that you go for. So that's the basic difference between the two. Coming to the third point, which is the course type. So in a certificate course, most of the time you will get a self-paced course wherein you will be provided with the study material and some online recorded videos that you will have to watch through. One day you will have to sit for an examination, and then once you sit for the examination, you will get the certificate for health informatics if you clear the examination. For a master's degree, as we all know, as usual in any master's degree program, when you join, it's a proper lectures that are provided based on all the subjects that are covered, and of course you also get the study material along with the course while you're pursuing. So it's like a proper lectures that are being given in a it's not a self-paced course. Basically, it's a normal regular master's course that is being done. The fourth difference lies in the job placement. Now, certificate courses, most of the time, they will not give you any kind of job placements or job assistance. It's only a 6 months program. So, people generally, the organizations which conduct certificate courses, they do not give any kind of, any kind of job placement or job assistance facility. But the master's degree, as usual, they do have campus placements. If anyone wants to, they do provide job placements through the campus, that recruitment which is being done in all the master's degree courses. The fifth difference lies in the audience. So what kind of audience goes for a certificate course? Mostly these are people who are already working in the healthcare healthcare industry. So these will be like people who are working on the, as hospital managers, or they are working in the health insurance domain. they want to also learn or expand their knowledge into healthcare IT vertical, these kind of people generally pursue certificate courses. It's not that freshers can't pursue. Yes, they can pursue, but they will have to, like, during the course itself, they will be they will have to build their own network of people who are working in the healthcare vertical, so that it's easy for them to find a job. Whereas for a master's degree, anybody who wants to, or who has time to spare, like 2 years, who can go for a 2 years full time, course, they can join the master's degree. Most of the time, these are freshers, fresh passed out graduates, whether from any medical or life sciences or paramedic stream, they generally go for these master's degree. So, the fourth question that we receive is, how is our certificate course different from others? Now, there are a lot of differences, when it comes to our curated certificate course in health informatics. The very first difference lies in the fact that we do not provide self-paced course. We are providing proper online live training sessions for a period of 3 to 4 months, and these are proper live sessions. Why live sessions? Because one, these are interactive. Second, the candidates who are pursuing the courses, while they pursue the course, they have questions in mind. So anybody who's a fresher also can join our course. They can understand. We give an in-depth understanding of how the healthcare domain works and what are the various concepts that are required in healthcare IT. So we do make sure that each of our students or candidates, they can interact through these sessions, and they can ask their questions and get answers to their questions on real time basis. The second difference is, we make sure that every student or every candidate who's joining our course, they have a dedicated mentor, so that they can reach out, or they can ask questions not just during the sessions but even after the sessions. So, to make sure that everyone's query, sorry, what am I saying? Query, everyone's questions are answered. We make sure that there is a dedicated mentor who can answer their questions even after the session is over. The third difference is that the course content that we have curated, it is absolutely based on the industry standard. It is basically keeping the industry in mind. We have curated this course. The concepts that are actually required to onboard you on a healthcare IT job, to start off your career, the course content is curated in such a manner. Most of the topics that we cover, these are relevant and these are in demand in the healthcare industry. The fourth difference lies in the fact that we make sure that the students are connected, they are well connected, and they are well aware of the industry trends. So we do have a lot of engagement activities with the industry experts, and we make sure that the students, they learn what is happening in the industry from these experts. So that's the another difference. And the last difference is, apart from the course structure or the course content that we will be providing through the healthcare informatics certificate course, we have also added some add-on values, which will definitely give you value once you complete the course, and will make you competent enough to grab a job in a healthcare IT industry. Uh, it'll be very, very easy to kickstart your career in healthcare IT if you would like to pursue our certificate course. So yes, these are the 4 or 5 differences that we have from the others. If you want to pursue our certificate course in health informatics. The other thing is, if you want to actually know what kind of topics are taught in health informatics, and what are the kind of information that or the concepts that are related to health IT, once my live session gets over, I'm going to link out uh, a link in the description, which where we had conducted a health IT awareness session, I think some few weeks back. So I will link the video to that in the description. You can definitely check that out, and this will basically help you to understand all the health IT concepts that are actually required in the industry. So the last question that we receive is, how much is the cost, the certification cost, and do we provide any group discount also or not? So the cost of our certificate course is 11,999, approximately 12,000 rupees. And we do not provide any kind of a discount, whether you come in a group of people or you are a single individual. Reason is, one, if suppose I get we make sure, first of all, we make sure that we only get a batch of 6 at a time. We don't want to go more than 6, because then, through online sessions, it becomes little difficult to interact with each and everyone, and we make sure that we have a lot of assignments also in between. So to coordinate with so many people, it becomes a little difficult if you go more than 6. So suppose out of 6 students, I get one as an individual student and 5 coming through a group. Right now, if I provide a discount to the group students, the individual student would not like it if he or she gets to know that they got discount. So we want to be very fair to everyone who's joining, so we do not provide any kind of a discount, whether you come as an individual person or whether you come in a group of students or candidates. The second reason why we don't provide a discount is because, see, there's a lot of cost involved while we are curating the content. Okay, and not just curating the content, there are other aspects of the course also. Once you join the course, you will understand what I can't disclose all everything all related to the course, but then we definitely make sure that all the during the course you actually get a lot of value from this particular course. So we make sure that every penny that you spend or on this course, every penny pays you back, provides you enough value, and makes you competent enough to grab that dream job of yours in healthcare informatics field. So that's it for today. These are the most common questions that we have got so far, and I hope that I was able to answer the questions as required by candidates or people who have asked me, if they're watching it right now. So, in case if you have any other questions, please feel free to ask in the chat box right now. Or you can also mail us your queries on our mail ID, which is contact.whatafterdentistry@gmail.com. If I'll mention all the contact details in the description box also, so that you can check it out later, and then you can reach out to us whenever, if you want to pursue this course. Don't forget to like, share, and subscribe to our channel. As I always say, please share it in your network. Somebody who wants to join or who wants to get into healthcare IT, it would be beneficial for them. So make sure that you like this video, you share this video, and you subscribe to our channel. I will see you in the next video. Until then, bye-bye and good luck. So if you have any questions, I'm waiting for the another 2 or 3 minutes, and you can drop it in the chat box. I'll be happy to answer. So, okay, so there's one thing also that I wanted to convey. We are soon coming up with an interactive session on this Saturday, which is 27th March at 4 p.m., wherein we will be talking about, the scope and opportunities in dentistry in Qatar and Gulf countries. So we have this interactive session with Dr. Merosha, who is a practicing general dentist in Qatar right now. So I hope that you guys see that event as well. That will be live on Facebook, I guess. So you will have to follow us on Facebook for that. I will be uploading the live video here on YouTube as well once we finish off the live session over there. So I'm waiting. If you guys have any questions, please drop in your questions in the chat box so that I can answer, or else I'll just end the video. Okay, then I guess I'll end the video right now. So I will see you in the next video. Until then, bye and good luck.